Hello everyone, welcome to this week's Couch Conversation. So I'm here in London, Ontario, Canada. My name is Richard Rosedale and I have my friend and colleague in Freiburg, Germany, Georg Soup.
Hello everybody. Good, Richard.
Yeah, so one of the things that I think MDT clinicians struggle with daily, and not just MDT clinicians, but other clinicians that use kind of a specific approach, is patients come in and their expectations may be influenced by lots of different factors, but what they experienced before being sort of maybe primary in that, in terms of they haven't come across what you're doing before. You're doing something entirely differently. And so how do you match their sort of expectations with what you're doing, and how does that work?
I think there is a basic issue here, and that's the difference between expectations and preferences of a patient. And I think we should look at these two in a kind of a separate way. So thinking about expectations first, and I have a nice analogy, and it really it shows the issue. So Richard, when you visit a hairdresser, what do you expect from the hairdresser? What do you expect from your visit?
A haircut.
A haircut. Yeah, that's simple, straightforward. You're expecting a haircut. That's easy. So you go into this barbershop, you take a seat, and you're waiting for your haircut. And the hairdresser last weekend, he went to a special class. He had a kind of a course, and it was a lot of about self-treatment, empowerment. You have to empower people to do more for themselves. And this guy learned a lot. And you're sitting there waiting for your haircut, and this guy just gives you a book, and the title is "Cut Your Hair by Yourself." I think this is on the long term, that's a great idea. So you save money, you're independent, you treat yourself somehow. But in the short term, your expectations are completely dismissed. You won't be happy at all because you expected something else. So if we just go ahead and treat your own back or treat your own neck or treat your something else on our patients, this won't work, because the expectation what might happen there is completely different. And if you go forward and sell self-treatment without any explanation, this might be a big issue.
Yeah, I agree. And I think what you said there at the end there is critical to this, without an explanation. And because, as I say, you're offering something that probably hasn't been offered before. Your focus is different. So the question is, one, obviously you have to know what their expectations are, first of all, so that implies some communication there and asking the patient about that. But secondly, how do you go about that? I mean, how do you explain to them why? I mean, they just want to get relief from this. They probably just want you to do something to them most of the time. That's what their perhaps expectations from before have been, to get rid of their pain, to get them back to where they want to go. So, I mean, I think we do need to have some explanation. I mean, one I sort of personally use, I talk about, the evidence and literature talking about musculoskeletal problems, low back pain in general, but of course, most musculoskeletal problems having this, natural history of, recurrent and episodic nature, being very persistent. And I ask them, if they know their friends, family have had back problems or neck problems before, or shoulder problems before, whether it's a one-off or whether it sort of comes and goes over their life. And they, most of the time they've experienced that people are telling them, oh, my back's bothering me again, oh, now it's better for a while, and now it comes back again. So in those terms, if I gave you something to do, if I did something to you just for this episode, then the next episode you'd have to come back, and the next episode you'd have to come back again. So, the reason why we try to focus on giving somebody something to do that they can manage the problem themselves is, in relation to this natural history and recurrency. So it's kind of, they have the tools. So I think that my experience is that explanation up front really helps to get their sort of buy-in in regards to in regards to that.
Yeah, that goes well, and I think that might work great with, especially with folks who have some experience with this kind of pain. So with recurrent issues, it might be a bit different if somebody has something for the first time. So I had just had a phone call today, making an appointment with a patient, and at the phone I got the feeling, oh, this will be a tough one, because she wanted some information about so what is it all about, and how will we do that, and what will go on there. So I explained to her, yes, I will ask you some questions to get an idea, and you will tell me your story, and then we will have a look at your neck, and we might come up with an exercise. And I will send you home with an exercise, we'll make an appointment, and then check how the exercise worked. And she was kind of upset somehow. Said, only one exercise? You will give me only one exercise? So I said, yeah, maybe also two, but we might start with one exercise. So what's your take on this? If somebody's complaining about just receiving one exercise.
Yeah, and I think that is also a very common experience, because people may be used to getting sheets of exercises, so almost dozens of exercises for people to do, and they come to see you and they don't get those sheets of exercise, and they sometimes just get, as you say, just get one exercise. And I like the little explanation of, if you went to I asked him, if you went to the doctor with a stomach problem and the doctor says, oh, I think I have a good idea of what's going on, and I think you need these types of pills in order to fix the problem. Are you going to sit there and complain that, the last doctor I went to, he gave me 6 different pills for this. You're only giving me one? That's not good enough. I want my money back. I want more pills, or I want my money back. And of course, you wouldn't be saying that. So that's the kind of the deal here. If we can find, if we can understand the nature of the problem and, pin it on a specific exercise you need to do to help turn that around, then that's what we're going to start with. Now that may change as we go along, but that's what we'll sort of start with, exploring just one exercise. It will be simple for you to do. You may need to do it with some degree of frequency, but you'll only have to focus on doing one thing.
Yeah, that's a great explanation. So, and one study from Norway comes to my mind, where they asked patients about their expectation before they visit a physical therapist, and then they asked for their kind of the takeaway with that, so their experience they had with this physical therapy now, and what they think actually was a good idea and what worked. And so looking at the expectations, it was mainly very much focused on physical function and exercises and diagnosis, and very much focused on this physical stuff. But then when they looked at the experience, so it was a qualitative study, and they found that patients appreciated empowerment, the shared decision making, getting some idea for self-treatment. So also the expectations might have not been met to a big extent. The patients were happy because they found that this really helped them to get a therapeutic alliance. So that might help us in our daily clinic. So we should not feel that every expectation of a patient should 100% be met. So it's not about that. And in some cases, we might come up with even a better idea. So we had this experience in our communication research we published in 2020. We had some patients, because we asked them about their expectation, and some patients mentioned that, oh, I expected something else, but I found that what I got was even better. So that was also a great finding.
Yeah, absolutely. And but I think so. Yeah, one, just because you can't align exactly with the patient expectation doesn't mean to say you can't provide care. But I think the important thing is to provide that explanation up front. And if you can't match your expectations, perhaps you're explaining why you can't match your expectations. and that may be towards the exercise, the example you gave, or it may be towards a different assessment we're doing, because we are doing a completely different assessment for many people out there as well. And so explaining to patients why we're doing this, why are we continually sort of moving them around in different directions and asking them the response. And if we give that explanation up front, that this is the way we figure out the nature of the problem, and in order to do that we need to we need to do that to target the treatment towards them. I think that ongoing sort of rapport is going to help them feel as though, even though it's not what they expect, you're actually bringing them along with the process, and they understand why you're doing what you're doing. I think is an important thing.
Yeah. So as I said, there are expectations and there are preferences. And there was a great paper just out last month from Bialowski and colleagues. They looked at patient preferences, and so they talked about preference concerning shared decision making, preferences concerning management, and they emphasized the fact that even earlier studies have found that not everybody likes shared decision making, for example, and at the end that in some cases it might make sense that you refer this patient on to another clinician. Because just the preferences this patient has and what you as a clinician can offer from your point of view and your education and everything just doesn't fit. So, and that's also something we have to keep in mind. You can't cure everybody, and in some cases it might just make sense to say, okay, that's what I can offer, and maybe it makes sense to see another clinician.
Yeah.
Nothing bad about that.
If you don't have that conversation, what may happen, and if you just kind of impose what you think is best for them on them, then I think these are people just don't come back again. And they do go somewhere else. So you can either suggest that if you find that there's really not an alignment, and they're not, there's not a sort of a happy place in between you and the patient, then if you don't have that conversation as to, well, you might want to go and seek out care elsewhere, then these are the patients that are just going to be no-shows in
Absolutely. So, and it's not only important to ask what are your expectations, but also what do you think what can help, and what could you do, and if you actually can't get along with that with the patient, and you can get on the same ground, so you might be just you might just go ahead and say, okay, that's it.
Yeah, absolutely.
Good.
Okay, well,
thanks a lot, Richard.
Thanks for the chat. Thanks everybody for listening in.
Thanks everybody. Bye.
Bye-bye.